Welcome to Desert Chat, Doctor. So happy to have you. You know, we love our friends at Desert Oasis Healthcare because we have so far had doctors coming on talking about senior health, men's health, even pet health. And today we're going to talk about us. We're going to talk about women's health. And, you know, I know most of us know the routine, you know, mammogram and all that, but there's so much more to the overall women's health concerns. So share with us really what we might need to be looking for and what's important for we as women.
Yeah, so women as whole people need the whole spectrum of care, and we know that the leading cause of death for women is actually cardiovascular disease. Yeah, so it's really important that women be checking in with their primary care physician, hopefully once a year, to get an idea of things like their blood pressure, their weight, their cholesterol, if they have diabetes, how well that's under control. We call it knowing your numbers.
Okay.
So women should know their numbers,
Okay.
and they can find that information by checking in with their doctor.
Yeah, that's so important. And you said once a year,
Yeah.
in case there's some concerns perhaps, and then of course you're more diligent about it.
Sure, certainly. So it's called an annual wellness exam. And so most insurances fully cover that for a
Nice.
once a year check-in with your provider. And it just depends on the payer, what is exactly covered during that. But essentially it helps us to do some strategic planning. What are your risk factors? What's your family history, your personal history? And then what are your goals? And then we can put together a whole plan for a strategy for that whole year. What testing they might need, if it's a mammogram or a pap smear, a bone density scan, and then also addressing psychosocial needs like depression and things like that. But all of that can be done at an annual wellness visit.
And what do you find really as patients come to you, what are their major concerns?
Well, patients' major concerns right now is really understanding how to stay healthy. I think a lot of people are thinking about longevity. And we know that women typically live longer than men. However, they have a longer disease burden. So they live longer, but they can be more unhealthy. So I think a lot of women are seeing that and asking, okay, maybe in my 40s and 50s, how can I start having a plan to stay healthy and adopting really healthy lifestyle choices?
Do you have some good tips to share? I know you do.
Funny you should ask. Well, really it starts, the foundation is always nutrition and then exercise. And then we know deep community involvement, which is something women are so good at, is building networks and really diving in and making connections.
I love that. Well, great information. Tell our viewers where they can get more information.
So you can visit us at mydohc.com, and you can find me at circecares.com.
Great. Well, thanks so much, Doctor. Maybe we'll talk to you again in February.
Sounds good, Sandy.
Thanks so much.